What's up, everybody? It is Webinar Tuesday, and we are so excited to have you join us today. We have a brand new presenter here who is going to be talking to us about occupational medicine and why DCs should be part of this conversation and be providing this service in their communities. And we are super excited to have Dr. James Raker with us today to talk about it. And I have to give a huge shout out to the best boss I know in the entire world, Dr. Ray Foxworth. It's his wedding anniversary. But I just want to say that I can't thank him enough for introducing Dr. Raker and us so that we could have this message brought to you today when we are looking for new and interesting topics and ways to help you grow your business and your practice. So, Dr. Raker, I'm going to let you take it away.
Great. Well, thank you, Christy and Dr. Ray, for having me here. And hopefully this will be interesting and enlightening for a lot of the DCs out there in our profession. So we're going to talk about occupational medicine. What is it and why should DCs do it? And here's a little background on me. I'm in Texarkana, a little town where Texas and Arkansas meets. I've been in practice about 32 years. I've been doing DOT physicals for over 20 years, and then I gradually learned and built the occupational business on these other services that we're going to talk about today. I've lectured all over the country. I'm a certified wellness instructor, and I have the distinction of getting an Arkansas State Athletic Commission license to be a ring doctor. There's only been, I think, a couple of us chiropractic physicians that did professional boxing as a ring doctor, and I've got about 400 or so matches under my belt, maybe more than that. I did it for about 6-8 years. So that was kind of interesting. I got to see George Foreman's son, Monk, fight and did his physical. So that was probably the highest named person. Most of them were local amateurs turning pro, but Monk Foreman was probably my biggest name, and George was there at the fight set next to me. So occupational medicine, or OCMED for short, it's a discipline of medicine that has to do with safety and wellness of workers. And because DCs are all about safety and wellness, this really fits together well. Now, and I think this slide is a little old. There's probably more like 27 services that DCs can perform in every state of the U.S. with only a few exceptions. Like DCs cannot do DOT physicals in Washington, Michigan, and New York State, but they can do a lot of the other services. So let's dive a little deeper into this. So before we talk about the services, let's ask these questions. Who need these services and why do they need these services? The who part. Part of the equation is DOT, which is the Department of Transportation. It's a federal division. There's about 20 to 25 million workers that are covered. And although most of the time when people say DOT, they kind of think truck drivers. And yes, that's a part of this. But really, DOT has truck, train, plane, bus, subway, ships, and pipe handlers. So there's 6 divisions. Now, the people that work in these divisions are either moving people or hazardous materials across state lines. That's what makes this a federal subject in federal law. So DOT law says that anyone that's a driver, pilot, engineer of a train, captain of a ship or a plane, workers, pipe workers, all have to have physicals, drug testing, and alcohol testing and belong to a consortium, which is the random process for the alcohol and drug testing. So these 6 divisions of DOT, which is 20 to 25 million workers, is worth about $3 billion a year every year. And some of this work is in every single town in the United States, and it's all federally mandated. And that's the short piece, or the small piece of the pie. The big piece of the pie is non-DOT work, and that is literally everybody else. So out of all the rest of the non-DOT work in America, there's some occupational services that touch about 90% of the rest of the workers. So now we're talking about another 150 million workers and $30 billion. So about $33 billion in total is spent every year on this. Now under DOT, we kind of recognize, the truck drivers and maybe the airplane pilots and bus and subway drivers and the train engineers. But besides semi-truck drivers, there's a lot of other drivers that this law affects that you don't really think of, but like concrete trucks, gravel trucks, garbage trucks, bucket trucks for the cable, electric, and phone companies, and even some people that drive a pickup truck pulling a trailer with a heavy piece of equipment on it, if it's over 10,000 pounds total, must have a DOT physical. And a lot of people don't know that. The state auditors or state police will stop people on the freeway a lot of times and suspect that they don't have one and weigh them and say you need one, and the person driving the truck didn't even know they needed one. So not everybody knows that they need one of these, but it really affects a lot of people. Now, what about non-DOT? Who's actually involved in this non-DOT work? And can we list some of these jobs so I know if there's some of this work in my town? And I'm going to surprise you and say it's in every town. So school districts, because of school bus drivers and teachers, both have mandated services that the school district must buy and perform for these drivers and teachers. Cities, counties, and state and federal workers all have certain enforcements of these, like firemen. They need a lot of physicals, drug screens, hearing tests, PFTs, because they wear respirators. Jailers have to have annual TB x-rays to make sure that they don't have TB, being in a closed population with all these prisoners. I drug screen from my bank, my grocery store, assembly line workers on factories. It's really just nearly every kind of job that's out there. 9 out of 10 people do something, drug testing probably being the most prevalent. But that's why it's so big, it's so prevalent, and it's everywhere in the U.S. No matter how big or small your city is, there is this work to be done. So what kind of services is out there? I named in the beginning slide somewhere around 25, 26 services. Let's kind of look at this, and I'm going to put up the graphic slide and kind of look at this. But remember, everything in red is mandated by the government that businesses buy it and they pay cash for it. There is no insurance billing for most Occumed services. So here's the DOT outline. Every single person, there's a physical, there's alcohol and drug testing, and a consortium that they have to belong to. Those are all mandated. And when you do the physical, sometimes things come up on the physical. These things over to the right are other services like a hemoglobin A1C test, a hearing test, a pulmonary function test, cardiac monitoring. These are all services that, although not mandated, if the physical is mandated and you do the physical and you find a problem, then these come into play where you have to the person has to get these done. And you can provide these in most states. Now with non-DOT, the ones in red, and Christy, this is where I was afraid I'd have a small slide that was going to be hard for me to read. But all the ones in red, there's heavy metal. In the middle, there's heavy metal testing and TB testing for lab tests for certain jobs. OSHA questionnaires comes into play for anybody that wears a respirator. There has to be an OSHA questionnaire reviewed by a professional. That's you. They have to have a fit test. They have to have a pulmonary function test with a spirometer. Those are all things that DCs can do. There's hearing testing that comes into play on many jobs. There's the second one from the bottom is not in red, talking about reducing recordable injuries, but that is going to come up in as a big thing. We'll see at the end of this slide presentation if I have time to talk about that a little bit, but that makes the difference for a company whether they choose you as a provider to deal with or not. So how do DCs get into this Occumed game and start delivering these services? First, you understand that out of the 25 or so services, there are 5 that you must be certified in. That's a DOT physicals, DOT drug tests, DOT alcohol tests, and then hearing testing and spirometry, which comes under OSHA and NIOSH, are the other That rounds out the 5 that you have to be certified in. And let's go back here. These services you can be certified as a layperson for everything but the physicals. So kind of make a little note in your head here. A chiropractic assistant that gets certified to do drug, alcohol, PFTs, and hearing can do those 4 things without the doctor being present. It requires no time from the doctor whatsoever. In fact, generally, I can say that 90% of my OCMED work is done by my assistants and takes no time out of my schedule while I'm working on patients. They're doing this and making money. So if you have a trained assistant that's certified to help you provide these services, that's where the 90% comes in. They can be doing the work while availing you to be able to provide chiropractic care. So unlike having a trained assistant doing therapy, which you have to be in the building or immediately available, once they're certified to do these occupational services, they can do them. They can go on site to a company, or they can be doing this while you're on vacation, or if you're sick, or even fishing or golfing. They can be doing this without your supervision at all. And that makes a big difference on your time. So here's kind of an example. I had a 700-person paper mill that wanted 10% of their workforce drug and alcohol tested every month. So that's 70 drug and alcohol tests, all done in one day. It took about 6 hours. So my assistant would go out at 6 in the morning and he'd come back at noon. He would have done 70 drug and alcohol tests. So that's $40 for the drug test and $25 for the alcohol test. So he would come back with a check for $4,550, and he would do that once a month, every month like clockwork for 5 years, all while I was in bed in the morning. So many of these services, once the assistant's trained, can go out and do this. This is a great cash income generator. Here's where a company called me and they said they wanted to hire 20 new workers to start a new shift. Each worker had to do a physical, a drug test, an alcohol test. They had to fill out an OSHA questionnaire that had to be reviewed. They had to do a pulmonary function test, a respiratory fit test, a hearing test, a heavy metal lab draw, some spinal range of motion, a NIOSH lift test, and some hand dexterity. So it costed about $1,085 per employee to go through all those tests. We did those all in one day. So while I was doing my regular 40 patients of work and adjusting chiropractically, when they would get somebody ready for a physical, they'd put up a flag and I'd go down the hall and I'd spend about 4 minutes doing the physical, and then I'd come back and keep working on patients. But by the end of the day, I finished my 40 regular patients, but we also had a check for $20,000 in that one day. So this is what I like about OCMED, is the fact that you can get a lot of work all in one or a few days, and your assistants do 90% of it so that you don't have to, but it really can generate some nice income, and it's mandatory from the government. So here's one of the checks, like for $20,000. It would take, over 500 Medicare adjustments in one day to make the same amount of money, and I did not work that hard. So we talked about this. The 5 things you get certified in is physicals, drug testing, alcohol testing, hearing testing, and spirometry. Out of those 5, the doctor has to do, number 1, physicals, but assistants can do 2, 3, 4, and 5. And DOT Physicals has a good story. I started doing them way back 30 years ago, but they started way before me. And any MD, DO, DC, NP, or PA could sign off on them. So they were routinely being done by a lot of the family practice providers across the country. There was probably 500,000 different providers in the U.S. signing off on these physicals. But in 2015, the government noticed that a bunch of the physicals were being done incorrectly. There were drivers out on the road with medical conditions that should not be. They were endangering the public's welfare and safety. So the government stepped in and said, we're going to create a certification for providers, and everyone's going to have to go through this certification and take a test. So they created a 12-hour course, and then you take a computerized test. And if you pass, you're then certified to do DOT physicals. They wanted to have 40,000 certified doctors to start the program. And the first year they tried to initiate the program, they only had 16,000 doctors, so they had to put it on hold. There just was not enough doctors to keep the wheels moving. So they put it on hold, and they waited 1 year. And when they delayed it a year and came around, they got 25,000 certified providers. They really wanted 40,000 because remember, it was starting off with like 500,000. But by the time they came around to the second year with 25, they said, you know what? We've told everybody about this. We have to turn it on. We have to go. So they turned it on. I was the only doctor in my town of 90,000 people that was certified. Most of the MDs were just too busy to take the 12-hour course and test. It's not that it's that hard. It's just they didn't want to put the time into it. So they said, forget it. We're not going to do this anymore. So when they turned it on, there was only 25,000 doctors, and I was the only one in my town. What happened next was my phone started ringing, and it was like a bad movie where every time you answered the phone and put it down, it just kept ringing and ringing and ringing all day long. It rang. And what it was companies that were in a panic that they needed drivers certified to get their physicals, and their doctor that they used to use was no longer doing it. So we picked up everybody in town from Coke to Budweiser to Frito-Lay, UPS, and on and on and on and on. It was just everybody was looking for somebody to do the physicals. Now, even now, several years later, there's only 75,000 providers where there used to be 500,000. So there's still not enough providers. There's still a big demand. And the fact that trucking is growing at about 6% a year due to Amazon and online ordering, it's phenomenal growth. So there just needs to be more and more providers doing this. The demand is huge. We had a company, trucking company here in town that had 1,000 drivers. And in the world of trucking, many times your drivers will get a better offer and they will jump ship and leave and go to another company. Every time they go to another company, even though it's not a mandate that they have to get a new physical, most companies will not accept the old physical. They want them to go through a new physical to make sure they're not hiring somebody that somehow cheated their way through the system and got a physical when they shouldn't. So there's a lot of turnover, and that creates more need for more physicals. So there's still a lot of work to do and very few doctors doing it. So really everybody needs to try and be one and take this opportunity. There is another 15 or so services that have no requirements of certification. You just need to know how to do them, and you can start providing the services. So they're easy. How much does it cost to start doing some of these services? It's really, really cheap to get into occupational medicine. The 12-hour government webinar certification to do DOT physicals costs somewhere between now maybe $299 to $399. But once you do that and take the test, you don't have to buy any fancy equipment. You have everything you need to do DOT physicals sitting in your office right now. For drug testing, there's a 2-hour certification course, costs about $250, and there's no equipment to buy. The drug testing company, the lab, sends you all the supplies for free. Then once you do a test, it's sent in, and whoever's doing the test, you collect the money up front, and then you pay the lab, and you get to keep what's left over as income. So it's really zero to, once you get trained, it's zero to start up, and you start making money right from the get-go. Fit testing on respirators, heavy metal testing, OSHA questionnaire review, DNA testing, none of those have certifications, and none of them have a upfront cost. It's very easy to start doing, very cheap to start doing. We got into some COVID testing last year and did phenomenal with COVID testing. There's no certification. You just buy the instant COVID test. A box can cost you about $500, but we were getting, actually we started at $50 a test, and we ended up going to $100 a test. And at one point we were doing 50 to 70 a day. So COVID testing, and I know with the vaccine out now, everybody thinks this thing's going to die down, but I really think with the variants, there could be some upticks, and I think it's going to be like the flu. This thing's going to be around, and just like we do flu A and B testing periodically on different individuals. I think COVID's going to be around forever, and we're going to still do some COVID testing as we go along. And I have a lot of companies that call me to do COVID testing. Our police station called us. They must have dragged in a prisoner or somebody that tested positive. So they wanted to test like 20 people that were in the room with him. So we did 20 COVID tests. So the testing is, most of it is asymptomatic people, and it's not hard. It's really easy to do, and we've all been around it now. So it's not really any worse than walking through Walmart as far as exposure rates. As long as you're wearing your mask and keeping your office clean, there's not really a problem. For alcohol testing, there's a 6-hour course, and you have to buy a breathalyzer. So alcohol testing requires a piece of equipment. The breathalyzer is about $800. There's some accessories that you have to buy for the first one, so it's about $2,000 total. The hearing testing requires a certification class and then an audiometer. So there's a little bit of an expense there with the class and the audiometer. Spirometry, same thing, a 2-day class and a spirometer. But I had a company that had painters. They had 300 painters, and they needed these spirometry tests. So we bought a spirometer, we took the course, and we did the 300 painters at $40 a piece and made $12,000. So it paid for the equipment, the training, and had a lot left over in just one day. Actually, that probably took us a couple of days with 300. But what I'm telling you is it's a vast amount of money. It's a high number of people when you're working with these companies. So, you know, at the very end of the day, I could say for about $6,000 worth of equipment and 2 weeks of training, you could do about 23, maybe now 26 services, some of which are mandated. The other ones are in such high demand, it's not a mandate, but everybody and their brother wants it and needs it. So you can get reimbursed really well. And none of this is insurance, except for COVID testing was paid with zero copay, zero deductible, mandated by all insurance to pay whether you were in or out of network. So it was basically free to the person. And you got to bill an office visit and a COVID test about $150 with no copay, no deductible. You just got a check. So we don't know how long that's going to last under this emergency order, but still COVID tested in the future, insurance will pay for it, or you just do cash for it. We did a lot of people that didn't have insurance and it was cash. So why is there no insurance reimbursement for all this government mandated stuff? You know, insurance generally pays for sick people, not well people. And what we're doing is we're testing well people, and we're doing it under a mandate, meaning the company sends people to us. The employee has no choice. When you're dealing with health, sickness and insurance, you get to choose your doctor. You get to choose if the doctor says he wants a test, you can say, no, I don't want that test. But under occupational services as a mandate, you don't get to choose anything. The employer says you go here and you get these tests done or you don't have a job. And because it's a mandate in that respect, you cannot, you don't bill the person. It's not their bill to pay. It's the company. So it's all cash, all paid by the company. And there's no, you know, insurance you have to deal with. Sometimes they take back stuff. Sometimes they cut your fees. Sometimes they do this or that or the other. This is more like, you know, in a contractual agreement, just like walking into Walmart. You pick up your food, you pay Walmart, and you walk out. There's no haggle. With these companies, you shoot them a price list. If they agree to it, you do the work and they pay you. There's no haggle. So how do we find these companies that need this work and get them to use us? Great question. Here's the simple answer. In occupational medicine, there is no bias. They don't say, are you an MD? They don't care if you're not an MD. In fact, because most of these services are done by certified lay people, they just really don't care. Other than the physicals that have to be done by a certified provider, and those can be done by a DC, they really don't care. You can be a doctor of any kind as long as you're certified and you can get the job done, you can do it on time, and you can do it for a fair price. They'll use you. It's as simple as that. You can actually sign up for third-party vendors that send you work. These big national companies like Walmart, Lowe's, Home Depot, all these big national chains, they sign up with a vendor, a third-party agent that then finds doctors to do the work for them at each one of their business locations. And all you have to do is basically sign up and get on the list, and they will start sending you the business. It's kind of like signing up for being a Blue Cross Blue Shield provider, and Blue Cross tells all their people, go to these doctors. It's kind of like that. So you can get on these third-party vendor lists, and the vendors tell the companies where the provider is in each town that they can go to. You can also find your own local work very easily, make a few phone calls, a fax, an email. I've went in person and talked to some businesses, and really what it boils down to is they need stuff done. It's a mandate. So you just walk in and say, I do the things you need. Here's my price list. It's better than everyone else in town's price list because I've already comparison shopped and made sure that it was. And you tell them, I'm going to get your people in and get them done and get them out. I'm not going to make them sit in my office for 4 hours like some of the medical clinics do. Those companies need that, want that, and love that. And that's why they love working with DCs more than they like to work with some of the medical clinics. So if the government came to you and said, you have to buy a certain kind of table or we're going to fine you, all you really want to know is where can I buy one of those tables quickly and at the best price? And it's the same for businesses. OSHA, DOT, NIOSH, all these government regulatory agencies are breathing down the company's neck, telling them they must do certain things to protect the safety and wellness of their employees. So they have to find the best person to provide these services at a good price to keep them from getting fined by the government. And generally, we know the overhead of a chiropractic doctor is lower than an MD or a nurse practitioner. So we can charge lower fees and still make more net income because we don't have the overhead to deal with. And some of the medical clinics only offer a few services. They may do the physicals, they may do some drug tests, but then the company has to send their people to other places to get the alcohol test or the hearing test or the spirometry test. If you do everything in one place, the companies will love that. They call it a one-stop shop where they can just send their worker, get everything done, and he comes back to work quickly, but everything's done. Otherwise, they have to send them to 2 or 3 different places, and it takes all day long, or sometimes 2 or 3 days to get the appointments set up and get him done. And they hate that. That burns up their time. If you've ever watched what happened when to the little small mom and pop stores in a town when Walmart moved in, it was like all the little stores just went out of business. Why? Because Walmart had everything you need at a good price. Everybody wants to walk in, buy everything, get it at a good price, and get out. If you had to go to 10 different stores, it would tie up your whole day. So Walmart comes in and makes one store their superstore that you can get everything. And that's what your business becomes, is the Walmart of occupational care in your town, where all the companies use you instead of all these other individual providers. So we've kind of went over this. There's OCMED services in every town, every state in the U.S. They're required by the government mandate for many of the services. They're all about safety and wellness. DCs can do most of them. Some in all 50 states, and like we talked about in the beginning, physicals can't do in Washington State, Michigan State, New York State, but they can do the alcohol, the drug tests, all the other things. It's minimally expensive to start doing any of this, and it just requires a little bit of training. And there's only really 3 pieces or 3 services that require a piece of equipment that costs $1,500 to $2,000. But you can buy those later when you need them. I didn't buy my first respirator until I had a contract in my hand from a company that said they had, like 300 people that were going to need this. Then I went out and bought the equipment, did the training, and it was all paid in 1 week, and it was done and over, and everything was gravy. So you can get the work by signing up with third-party agencies. You can get local work by talking, emailing, and faxing local companies. It's all cash. There's no insurance. And I've shown you checks. You can make up to 20. I've actually got a couple for $30,000 for maybe 2 or 3 days of work. And it's repeat business. The government says these companies have to do this, and most of it's annually. So if you do a company 1 year, you will make that same amount of money a year later, and the next year, and the next year, and the next year. It just goes on and on and on. And there's really very little competition in this area. The medical clinics do not do a very good job of doing this. Most of this is being picked up by lay people. An individual can go get certified to do hearing testing, buy 2 or 3 audiometers and a little mobile van or truck, and go around and do hearing testing. And that's who you're competing against. And when you walk in and say, I'm a doctor and I do all these services, the company's like, thank God, someone that we can count on that does everything. We can get it done fast. They like that. It's very easy to do. And they really didn't mention this. As good as occupational medicine is from an income standpoint, if you want new patients, remember in the old days in school, they used to tell us, go out and do spinal screening. Stand at the mall or at the fair or go somewhere where you're standing and screening 100 patients or 100 potential patients for free, maybe in the hot sun. I get paid to do spinal screening. When a company sends me their workers and I'm doing their physicals, I'm essentially doing a spinal screening, but I'm getting paid anywhere from $65 to $85 for a physical. And many, many times these people turn around, they tell me, you've told me more in 5 minutes than my MD's told me in 5 years. Can I be a patient? Or how do you accept new patients? How can I be a patient? Holy cow, it's a great new patient generating machine. Another thing happens is companies, once they see you working with them, they trust you. I don't know very many doctors. Some states work comp is still a good thing. In Arkansas, it's good. In Texas, it's terrible. But in some states, you try and help companies with work injuries, and they literally slam the door in your face. There's like a chiropractor, get out of here. Once I started doing this, what I noticed is, and I don't like to do work comp, but every single company that I worked with would turn around eventually and say, you know what? If we had someone that got hurt, could you take care of their work injuries? So I was like, yes, I can. So number 2, it started generating, if you want it, work comp, and you can get every injury that comes. So I have companies that I'm the company doctor for that has 1,000 people. I have a 300-person bakery. I have a 700-person paper mill. And I see everything. I see burns, cuts, dirt in eyes. If it's not their leg cut off going to the ER, it comes through me. And if I can't handle it or don't want it, I send it to a specialist. But I'm fully functioning as the company doctor, primary care. I'm seeing lots of stuff, not just musculoskeletal stuff. So it's kind of fun if you want to get off and do some things that are a little off the musculoskeletal beaten path. But it does give you a new level of respect from the company and the community that you're not just a chiropractor, you are a doctor of chiropractic. So it's really cool. And I have had some new doors open up. I had one DC that took my informational seminar, and then he went into a Coca-Cola plant in Memphis, Tennessee, told him what he could do. They offered him a salaried job and built him an office inside the Coke plant, and they put him on salary 3 days a week to take care of all the Coke employees. So that was kind of cool. And I know of at least 2 or 3 DCs that now run the occupational division of a hospital on a salary. So that'd be nice if you had, somebody wanted to offer you a big job and a salary, and you didn't have to worry about, employees and buildings and everything else. So there's a lot of opportunities here. So I hope this presentation was both informative as to the mandates and enlightening is the fact that you now know there's some 20, probably 5 or 6 healthcare services that are readily available to DCs in all 50 states, costs very little to start doing, but creates a new income stream that's not dependent on insurance. And we talked a little bit about this earlier, COVID testing. Since we're still kind of in that COVID mode, I want to cover this really quickly. There's 3 kinds of COVID testing. There's a finger prick of blood, which is an antibody test, a nasal swab antigen test, or a nasal swab PCR test. PCRs, though, take days to get back. The other two are more instant in 10 to 15 minutes. Insurance has been mandated under the emergency authorization to pay for this. As I said earlier, to pay for the office visit and the test with no copay, no deductible. Doesn't matter if you're in or out of network. The only problem that DCs would have is you won't get paid for this from Medicare or Medicaid, but all your private insurances, your self-insureds, everybody else has a mandate to pay for this. And if people are uninsured, there's a government program that you register through Optum Network, and the government pays you for uninsured people to do an office visit and a test. Companies. Now, the government mandate is that if they have symptoms of COVID or they've been around a known positive COVID, the insurance is mandated to pay for it. But let's say you want to return to work, you were sick, and now you want to go back to work, and work says, well, we're not letting you in the door unless you test negative. That is a cash pay because you're no longer symptomatic. You're no longer around a known positive person. You're just trying to get back into work. So you have to pay cash. There's people that want to get into the nursing home and see grandma or grandpa, and the nursing home says you can't get in the nursing home unless you're proven negative with a test. They have to pay cash. Or if you want to get on a plane and fly somewhere, you have to prove you're negative. And again, that's a cash service because you're not having symptoms. You don't want symptoms. You've quarantined. You've specifically tried not to get symptoms. Those are all cash that insurance doesn't pay for. So the COVID testing was costing around $20 to $30 for the tests, and patients are going to pay $50 to $100. We were doing, even up to 70 tests in a day on certain days when it was really hot and heavy. And we even got referrals from schools to test teachers, schools to test kids, from patients, from businesses. I told you about our city calling us with the policemen that they needed like 20 tested. Even the local ER was too busy doing sick people. They couldn't deal with the asymptomatic people. They called me and sent the asymptomatic people to me to be tested. So we were doing a lot of tests. This is where a company called us and said, we want to test everybody in our company. There's 180 employees. And I told them it would be $100 a test. So they sent me an invoice, said you've got up to $20,000 to spend. So I actually got a check that ended up being like, the check itself was like $18,900 and some dollars. So cash is king on that deal. Here's another check. We did a bunch of work for a company. It took us like 2 days, 3 days, and we got, $30,000. So I just want you to be aware of the fact that occupational medicine, a lot of people just do DOT physicals and they make, $60, $80, $100 per physical. And they think, doing 3 or 4 of those in a day, or 100 a month is a good deal. DOT physicals is the tip of the iceberg. It's the other 20 some services, especially you have to be present in the room with a person working to do a DOT physical. These other services, your trained assistants can do, and you don't even have to be there. So here's another one. We spent like 5 hours out at a tank car manufacturer and got, $9,000. So this is me, and this is what I teach and do. And hopefully this was enlightening. And if there's any questions, I would love to entertain questions.
Thank you so much. I do not see any questions yet, so I'll give everyone a few minutes to post any questions that they may have. And there is an email here as well. So if you do have questions that you think about later, I don't know about you, but I am notorious for, I will watch a webinar and then later that day or the next day, I'm like, why didn't I think of this question when I was on the webinar?
Exactly. Either I did a really, really good job or a really, really terrible job. So hopefully it was good though, and people kind of understood what was going on here.
You know what? I think a lot of times, I think it's a lot, and this is like a whole new, avenue for your practice that it's probably got a lot of people's wheels spinning. They don't even know what they would like to ask at this point just yet. Just want to remind everybody that we do have a webinar next week, White Label Your Nutrition with Dr. Fab Mancini. And then we are taking a week off from the webinar. So we will not have a webinar on the 23rd, but we will come back with a webinar on the 30th. We have some exciting news that we'll be announcing on that webinar on the 30th. So just stay tuned. Oh, now we got a whole bunch of questions that just popped up.
Oh, good.
And to answer this one, because I get this one all the time, is every webinar that we have is recorded. So they will all be available. So if you've registered and you're watching this right now, just know that in about an hour, you're going to get a link to the webinar recording. That link will also be posted on our website under archived webinars, where it will live for all of eternity, unless this information gets updated and we bring Dr. Raker back to update that information. So with DOT physical certification lasting 10 years, what percent will not recert in 2026?
I don't know. That's kind of a forecasting question. I would say the only ones that are probably not going to recert are the ones that are retiring.
Okay. How long do you schedule an appointment for each of the services that you provide?
Oh, there are so many services. Well, here's the thing. I have a couple of dedicated assistants that do all this, to where they run a schedule separate from mine, because it doesn't take any time out of my practice life. So for DOT, say drug test, alcohol test, literally each of those take like 4 minutes, 5 minutes. So they will just put people on the book and schedule people on the book, and they'll just do all that all day long while I'm doing my thing, adjusting patients. And only if they get a physical, which requires my presence. And on a DOT physical, literally my assistants do a bunch of it, and to the point where all I have to do is walk in and do the doctor part, which takes about 3 minutes on a simple one, maybe 5 minutes on something that has a problem. So literally, I don't really pay much attention to their schedule. I just do my chiropractic schedule, and whenever they have a physical ready, they'll just throw up a little flag in the hallway that says I've got a physical. I'll run down and do it, and then come back and start doing what I'm normally doing. Now, I have had a couple of people that built their occupational business to the point where I had a doctor in a town of 2,000 people in Ohio that just, after 5 years, he called me and he said, I'm shutting down my office. And I was like, man, you're doing so great. What went wrong? He goes, no. He's like, my occupational business has tripled. I just don't want to deal with patients anymore. This is so lucrative and so easy. I'm just not going to see patients anymore. And I was like, I really didn't teach this for you to give up, chiropractically adjusting patients. But he is like, it's just too easy and too much money. I don't want to fight with insurance, and I don't want to fight with patients anymore. So I've had several doctors that did nothing but straight occupational work, and Dr. Abear in Corpus Christi averaged $75,000 a month, and it was easy.
Where do you find the locations to be certified for these services?
Oh, you can Google stuff, but I can tell you, if you go to www.nationalwellnesscourses.com, that is ran by Dr. David Clayman with a K. He's in New Jersey, and he got a certified program by the government approved. He's a DC. So I kind of steer everyone to Dr. Clayman so that we keep the money in house and we're not paying it to non-DC medical providers for the training.
Do you find that employers prefer to have you on a regular schedule or randomized?
That's hard to answer. There are certain things that they do on a regular schedule. You can schedule it way out and know it's regular, but they do have random things happen, like they may have someone quit and they have to hire a new guy. And that's just kind of random, that he has to come in and do maybe an employment physical and drug test or something like that. It's kind of randomly. Or if they have an accident, that's kind of random when the accident occurs. You can't really schedule an accident. So he may have an accident where he runs a forklift into a piece of equipment, and they will usually drug test them, because under most state work comp laws, if someone has drugs or alcohol in their system when they get their work injury, they don't have to pay for the work injury. They just fire him and toss him out. So there are some random acts and there are scheduled things. Where we talked about going to the paper mill, once a month and doing 70 drug and alcohol. That was scheduled to where we knew when it was going to happen. We could plan, weeks ahead, and we could do it on a schedule, and it was very easy to do.
How long does the average person stay in the office to complete all these tests?
That just depends on, I don't think there's anyone that goes through all 27 tests. It varies by occupation on what they need, but I can give you some general time frames for each one of the tests. A DOT physical, staff time involved, my time is about 3 to 4 minutes, but staff time will mean that from the time the person walks in till he walks out from a DOT physical is approximately between probably 10, 15 minutes. A drug test, if they can go to the bathroom and not say that they can't go, if they can go, it should take roughly 5 to 7 minutes. An alcohol test is probably 4 minutes. A hearing test is about 10 minutes. A pulmonary function test is about 8 to 10 minutes. And like a heavy metal, it can be a blood draw or a urine collection for heavy metals. Really, none of these are long evaluations. Probably the DOT physical is probably one of the longest ones at maybe a 10 to 15 minute time frame for the staff from the time they walk in until they walk out.
Okay, and then this is a lot of great information. Thank you. Do you have anything specific to the Michigan scope of practice?
Michigan is one of the states that you can't do DOT physicals in, but by federal law, because a layperson can be certified to do drug, alcohol, run a consortium, you can do those 3 out of the 4 mandated DOT services. And then in the non-DOT world, you can still pick up that drug and alcohol for non-DOT. A layperson can be hearing and PFT certified, so you could do those 2 things, even under Michigan law. And then we'd have to sort through some of the rest of it is a case by case. Heavy metal evaluations, if Michigan doctors can order lab work, then they could possibly do the heavy metal evaluations. Hand dexterity probably is not a problem for them. I'd have to go through all 27 and then look at the scope of practice. But those are the ones that I know for a fact that you could do. So even without the physicals, you can do many of the other services.
Okay, I don't see anything else. That's a lot of great questions. I love when I see some in-depth questions come through. And
yep, that means I got them thinking a little bit.
It does. See, I told you did a good job.
Wonderful. Love it.
So again, I just wanted to remind y'all that I think I did post it. I did. Dr. Raker's email address is available if y'all have additional questions that you think of after the webinar, or if you happen to be watching the recording and have questions that you would like to ask, make sure that you reach out to occmedfords@gmail.com to get those questions answered. We want to thank you so much for being a part of our weekly webinar series, for tuning in this week. And we have one more question that we're going to answer because I thought we were going to wrap it up a whole 11 minutes early, which is unheard of for us. Does the state board give the qualifications for who can do which service?
No, it does not fall under the state board. The only thing that the state board would come into play is for the physicals. As long as the state said that you could do physicals, the chiropractor can do physicals. And so Michigan, Washington, and New York State are the only 3 that says DCs can't do the physicals. Everything else is a lay person certification. So anyone off the street can do this, which means any one of your CAs can get certified and do.
Excellent. That was such a good question. I had to ask that while it was popped up. So again, just a reminder, if you have those questions, reach out using that email address that's provided. It's in the chat box. You guys can see it if you're watching the recording and live. And if you have any additional questions, just let me or Dr. Raker know. Again, we'll see you next week. And as a reminder, we are taking March you routinely block off your schedule every Tuesday at 2:15 Eastern time to be a part of this webinar series, let me encourage you to leave it blocked off on the 23rd. And I hope you enjoy a nice leisurely lunch break for an hour in peace, because I know y'all deserve it, even though I suspect you won't do that. I suspect you'll see a patient, which I understand that too, but I hope you take a break. But we will see you next week, same time, same place, with Dr. Fab Mancini, and we'll be talking about nutrition. Have a fantastic week, and I'll see y'all next week. Bye,
Thank you,
everybody.
Christy. Bye.